Despite the challenges in treating glioblastomas, increasing evidence suggests that targeting the immune cells within the tumor microenvironment can lead to improved therapeutic responses. Here we present a novel closed-loop controlled, microbubble-enhanced focused ultrasound system and test its abilities to overcome the impediment posed by the blood-brain barrier to safely and effectively target the GBM-TME using immune checkpoint blockade. Our system feedback controls the third harmonic acoustic emission level during MBFUS. Our controller has three main features. Firstly, to safely sustain desired oscillation strength, we employed a proportional control law to control the input pressure, while turning down pressure when broadband emission is observed. Secondly, to ensure additional stability, the gain of this control law is modified in real time using pre-obtained cavitation threshold model. This model can be further trained in real time as we do more sonication and obtain more cavitation data. And lastly, the system applies a secondary constant pressure pulse that interleaves the main controlled pulse, and this enables real-time monitoring of microbubble kinetics. Tracking of microbubble kinetics acts as an on and off switch and ultimately allows the controller to adaptively choose its operation duration. And in this study, we firstly trained the controller by using constant pressure sonication in healthy mice and tested its performance in both healthy mice and GL261 tumor model, followed by a survival study. To train the controller, we identified the relationship between third harmonic acoustic emission level and K-trends, which is a measure of vessel permeability extracted from DCE MRI. From constant pressure controller training session, we identified two things. First was the two close but distinct target levels to be used in the controller, and second was the pressure to be used in microbubble tracking pulse. Here we selected the two target levels depicted as low H3 and high H3, which were just below 3% ultraharmonic and broadband probability, respectively. And we also selected 70 kPa as microbubble tracking pulse pressure, since there was no evidence of BBB opening using that pressure. To test the performance of the controller, we sonicated left and right hemispheres of a healthy brain with low and high target levels. The performance of the controller in healthy mice indicated that the controller is able to fine-tune acoustic emission and distinguish the two target levels with short rise time and precision, while effectively initiating and ceasing the controller operation depending on microbubble kinetics. What was interesting here was that during controller training session, where we used constant pressure, we found that over 40% of broadband emission were clustered during the initial 10 seconds after microbubble arrival to the brain. However, with closed-loop controller, broadband emission during this time point was effectively suppressed with few total broadband emission events. To assess the BBB phenotype changes in healthy mice, we collected DCE MRI immediately after sonication to measure K-trends, and we sacrificed the mice 6 hours after sonication to assess ICAM1 through immunofluorescence microscopy. ICAM1 is considered as most important anchorage molecule for immune cell transmigration. Here we found that both K-trends and ICAM1 showed upregulation trend proportional to the target acoustic emission levels, which suggests that closed-loop controller can facilitate controlled changes in BBB permeability, and the key inflammatory marker ICAM1 is a function of acoustic emission exposure. To assess if our observations will be preserved in the brain TME, and to investigate the effect of controller in anti-PD-1 delivery, experiments were replicated on GL261 tumor model. Here 3 groups were studied, and control group was treated only with anti-PD-1, while low and high H3 groups were treated with anti-PD-1 combined with low and high H3 target levels. Here tumor sizes were spread equally across the groups. And we observed similar performance of the controller in tumor microenvironment, suggesting that the controller is robust to the biological variability introduced by the GL261 tumor model. Evidenced by immunofluorescence microscopy, similar to healthy brain, we found upregulation of ICAM1 expression in tumor as a function of target level. While due to abnormally leaky environment, DCE MRI showed no difference in the BBB or BTB permeability across the groups. Here our data suggests that level of acoustic emission is a better predictor of ICAM1 expression as compared to K-trans values. Furthermore, we also found improved anti-PD-1 delivery as a function of target levels. Interestingly, MBFUS treated groups had significant increase in IABA1 positive area, which stains for microglia and macrophages, as well as its colocalization with anti-PD-1. Moreover, we stained the control group and the group with highest anti-PD-1 delivery with CD64, which is associated with pro-inflammatory M1 polarization. We found that the high target level group produced significantly improved CD64 area and its colocalization with anti-PD-1. We also assessed the presence of PD-1 positive CD8 T cells within the GBM-TME through flow cytometry. Importantly, we found that there was a notable presence of PD-1 positive CD8 T cells in the tumor, which serve as resource cells for anti-PD-1 therapy, suggesting that enhanced delivery of PD-1 treatment antibody may lead to a therapeutic response. In aggregate, our results demonstrate that the closed-loop controller enabled the anti-PD-1 delivery in an acoustic emissions-dependent manner and promoted the local accumulation of pro-inflammatory macrophages in PD-1 positive CD8 T cell abundant GL261 TME. Finally, to assess the efficacy of improved anti-PD-1 delivery, we conducted survival study between the control group and high target level group. On 7th, 12th, and 17th days after tumor implantation, control groups were injected with anti-PD-1 only, and high H3 group was treated with sonication followed by anti-PD-1 injection. And as a result, we found that by promoting strong and stable microbubble dynamics, the closed-loop controlled MBFUS combined with anti-PD-1 resulted in statistically significant improvement in survival. Strikingly, one long-term survivor in high H3 group had the tumor completely disappeared. And the rechallenging experiment revealed that the mouse had developed resistance to GL261 cells. And flow cytometry, after 4 months after rechallenging, revealed that this long-term survivor induced sufficient long-lived memory T cell formation, specifically within the brain. To conclude, closed-loop controller can safely and accurately tune FUS exposure and attain different regimes of microbubble dynamics behavior. And also attaining strong microbubble dynamics can facilitate significantly improved anti-PD-1 delivery that induces improved survival and anti-tumor immunity in GL261. And lastly, the controller is in position to establish and strengthen the link between microbubble dynamics and immunomechanobiological responses, ultimately to further enhance immunotherapeutics and understand its underlying mechanisms. And lastly, I'd like to introduce our lab and lab members, and thank Focused Ultrasound Foundation and NIH R37 grant for supporting our research. Thank you.